my name is Chelsea. I'm going to be your nurse today. I checked my physician orders and it looks like there's an order placed to do some trach suctioning and cleaning up and changing your trach dressing. Is that okay? Okay. And then let me just check your armband here. All right. And then I also checked with the MAR. It looks like it matches up. And no allergies that you know of, Sarah? Okay, great. So first what I want to do is I want to do a quick assessment on you. But have you had trach suctioning before? Are you feeling okay about it? Yes, okay. All right. So then I also checked in your chart and I looked at your vital signs, and it looks like your lung sounds, you get a little crackly here and there, but otherwise your oxygen stays pretty stable. So I'm just going to put this pulse ox on your finger here, and we'll leave that on throughout. And then I'm also going to just listen to your lung sounds here. Take a deep breath for me. Okay. And again. And again. And again. Okay. Yep, it does sound like that we could use some suctioning and clear some of those secretions out. So let me put this stuff off to the side here too. Okay, so before I get started, I do want to hyperoxygenate you first. So I'm just going to turn up the oxygen here, and if at any point you're uncomfortable, just raise your hand for me, okay? So I'm also going to just check your finger. So it looks like you're at 98%, that's great. I want to check your skin turgor to make sure you're hydrated, which you are. And then I checked your humidity levels here too, and they're all set. I'm turning up your oxygen, and then I'll turn on the suctioning when we're a little bit closer too. So I have all my supplies over here. And just want to make sure that I keep everything sterile. And I have my sterile water here, it's unopened. I want to make sure that I date and time it because it does expire after a certain amount of time. And then I have my trach kit here, my sterile gloves, and some extra supplies here. Just gonna set this to the side too for later. All right, so I did clean my table first, so that's all good to go. So first I want to get my drape out. So I have gloves on top here, so I'm actually gonna get rid of these gloves because I have my own. I want to be careful, get my drape out. And just touching the 1-inch border here, carefully. Set my sterile field down here. Next I'm going to carefully empty my supplies onto my drape. Making sure not to reach across any of my sterile areas. I'm also going to open up the inner cannula, and I do have the same size inner cannula and one size smaller in case we have any issues. I also have an ambu bag at the side of the bed. Okay, so before I put my sterile gloves on, I'm going to put my palm on the label here and just carefully, okay. All right, I thought that splashed, but it looks like we're good to go. So I'm going to actually just set this off to the side, and I'm going to put my sterile gloves on here. So I want to make sure not to turn my back to my sterile field. sure not to cross over top of my sterile field. Grab the edge of the cuff on the first one, my dominant hand. Okay. And swoop into the cuff. Don't need that anymore. All right, now that I have 2 sterile hands, I'm just going to move around my supplies here. So I'm actually going to put a couple of gauze into my sterile water here. I need a dry one to dry it off after I clean it. I need the split gauze to replace hers. And then I want my 2 cotton swabs in the sterile water as well, so I can clean. Okay, so next I'm just going to take my suction catheter here, untangle it. I'm going to make sure that I don't break my sterile field here because I do have the inner cannula in there and I don't want to get that dirty. So I'm right-handed, so I'm going to take the suction catheter, wrap it around my hand so I can connect it. Okay, so now I am committing my hand to be dirty. So first I'm going to get the suction tubing, got it nearby, and I'm going to connect without breaking sterility of my right hand. And then I'm going to turn on. It's gonna get a little loud here. Okay. And I'm hyper-oxygenating you there. I'm just going to check and make sure that the suction catheter is working. Okay. All right, so I'm just going to start suctioning now. And then once you cough a little bit, I'll pull it back out a little, okay? All right, actually first, let me just pull this back to the side. Okay, making sure not to suction on my way in. Ready, 1, 2, 3. Cough, okay, good. And suctioning out, all right. Wrap that back up in my sterile hand. Give you some more oxygen there, let you recover a little bit. I'm gonna give you a full minute in between suction passes. It looks like your oxygen's still good. I don't notice any signs of distress here. I also would listen to your lungs at this point again just to make sure, but so far it looks like you're stable. Okay, and so a minute has passed. You ready for some more suctioning? Okay. Remove the mask again here. I also want to clear out the suction tubing of any thickened secretions in there. All right, and I'm gonna go in one more time. So you cough. Good. Suction. All right. How does that feel? Much better? Do you need me to go again, or are you good? All right. Put your oxygen back on there. Okay. Do you need your mouth suctioned out at all? No? Okay. So I'm going to disconnect this here. Now that I'm finished suctioning, I no longer need to be sterile, so I'm actually going to get rid of suction catheter. And I am still going to be careful of my sterile field because of that inner cannula. And dispose of my supplies. I want to make sure that I am taking note of those secretions. That way I can chart on that later. How much, the color, the consistency. All right, Sarah. So next I'm going to change that dressing, okay? And then if it's painful or anything, just let me know by raising your hand, okay? I'm just putting clean gloves on here. I get my trach tie ready. Okay, so first what I'm going to do is just take some gauze, wring it out, set that off to the side. Okay, so I'm going to, oh, it looks like your last nurse didn't put a split gauze there. So I would pull that out and check for any secretions on there. I am assessing the stoma here. Are you okay if I take the oxygen off for this part? Okay, great. All right, so taking a look at that. There's no redness, there's no drainage coming out around it, no signs of infection. So now that I've taken the soil dressing off, I actually am going to change out that inner cannula. That way we don't get the clean dressings dirty. So what I'm going to do is I'm going to hold on to the faceplate, pinch the fasteners, pull it out here. Okay, I'm gonna check it, make sure it's patent, no any secretions. I'm gonna get rid of that and only touching the outer part, the new one. I'm going to replace it here. You feeling okay? All right, click that in place. All right, oxygen is still looking good. All right, and then now I can get to cleaning. So first I'm just going to clean the faceplate here, get rid of any secretions, and good wiping. Okay. Next I'm going to use my cotton swabs and I'm going to clean in a circular motion around the stoma site. And I like to use one on the top and one on the bottom. Okay. And then I just want to pat dry. Don't want to leave any water on there. We don't want skin breakdown. I'm just going to pat all of that dry around the area. Still doing okay, Sarah? Great. All right. So then next, let me change your trach ties. So I'm going to leave the old trach tie in place since I don't have somebody to help me hold on to the trach itself. So I'm just going to make some room and loop it through. And then I'm just going to wrap this around your neck here. Loop it through on the other side. Making sure it's snug with 2 fingers. Now I can release the old one. Making sure not to tug on your skin or cause any skin breakdown. Oops, sorry. Okay. Throw the old one away. And I'm just gonna make sure that this is snug. Does that feel comfortable for you? Okay. So then next I'm just going to put the split gauze under the faceplate there. I just want to make sure that it's smooth, has no wrinkles, so we don't cause any pressure on that skin, cause any skin breakdown. Good. Checking and make sure that it's snug. 2 fingers. Okay, it's nice and smooth. Put your oxygen mask back on. Still feeling okay? All right. So now that that is all finished, I do just want to do a quick assessment of your lungs again. All right, so go ahead and take another deep breath for me. Good, and again. Good, and again. And again. Oh, much better. Now your lung sounds are nice and clear, so I'll make sure to chart that. And I'll chart the frequency that it's needed, and I didn't need to do any excess interventions. I'll take this back off. I will make sure to chart your vital signs, your skin assessment of your stoma, your respiratory assessment, anything about the secretions that I noted. And I think that is it. Is there anything that you need from me right now? No? Okay, so I'm just going to make sure your bed is down. Are you in a comfortable position, or do you need up a little bit more? It's good. All right, here's your call light, Sarah. All right, and the wheels are locked, side rails are up, and then I'll clean up my supplies here, and then we should be good to go. All right, thank you. Have a great day.